allegiance. I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Housekeeping note, this meeting is being recorded.
Did you not bring your?
I
Oh, I thought you had your. Sorry.
evidently did not bring
Okay.
mine with my notes on it. Thank you. Okay, let's start with introductions. We have our warden down there at the end. Good morning, warden. Would you like to start with introductions, please?
Good morning, I'm the warden.
There you go.
Stop all off that meeting, Farm Bill.
Brandy Hollabaugh. I sit on the Women's Leadership Committee for Elk County Farm Bureau.
Thank you.
Ray McMahon, Elk County Farm Bureau. Mark Ray. Bernie Matoush, Elk County Farm Bureau.
Morning, sir.
Marilyn Seco, the Courier Express and the Daily Press.
Matt Fry, Elk County Treasurer.
Rick Brown, Elk County Solicitor.
Greg Bauer, Elk County Commissioner.
Fritz Schlecker, Elk County Commissioner.
Morning, Matt Weasenberry, Elk County Commissioner.
Scott Straub, Elk County Chief Clerk.
Emily Anders, Office Administrator.
Dwight Orr, Elk County Healthcare Authority. Gary Anderson, Elk County Healthcare Authority. Elmore, IT Director.
Morning, everyone. Okay, great. So we have a full meeting this morning, which is nice. We have an agenda before us. Any changes, corrections, additions?
Big motion, we approve the agenda as prepared. Second.
We have a motion and a second. Thank you, commissioners. All those in favor signify by saying aye.
Aye.
Aye, motion carries. We also have before us the minutes of the November 6th, 2025 regular commissioner meeting. Give you a moment to look over those. We also have the minutes of a special meeting we held last Thursday, a short meeting here, the America 250 PA mini grant presentations. Any questions, comments, edits on the minutes? Hearing none, look for a motion to approve the November 6th, 2025 regular commissioner meeting minutes.
So moved. Second.
The motion is second. All in favor signify by saying aye.
Aye.
Aye. Motion carries. Thank you. And look for a motion to approve the November 13th, 2025 special commissioner meeting.
Motion to
minutes.
approve. Second.
Thank you. Commissioner, all those in favor signify by saying aye.
Aye.
Aye. Motion carries. Thanks. Moving on to presentations. We have two gentlemen here from the Elk County Healthcare Authority. Good morning, gentlemen. Thanks for being here. I know we have a little business later on to reappoint some board members, but or it's yours.
Thank you. I put together a little PowerPoint presentation that was actually based on the Pennsylvania County Commissioners Conference at Seven Springs that I attended. And I was on a chair on a work group on rural health or on Pennsylvania health systems with the health director from Chester County and the Rose, who's the new president of the IUP, Doctor of Osteopathic Medicine School. So it was a pretty good conference. We got a lot of good, Elk County got a lot of good publicity out of that conference and a lot of requests for information on what we're doing to try to return healthcare to rural areas. Let's see, page down. Here, this one's right. I went through a little history, which all of us are familiar with. You know, the hospital was founded in 1922 by the Benedictine nuns. Traditionally had tremendous community support. It was donated to the city of St. Mary's by the nuns, which the city set up a board of directors to run. In 2013, the hospital board decided to merge with Penn Highlands. The hospital was profitable at that time, and the hospital was part of a community-centered system. Penn Highlands embarked on a growth strategy, as everybody else did. But they moved from a community-centered system to a hub and spoke design. And they, if you look at their financial dog and pony show that they put on for the bond issues, they designed 3 hubs. And this area was one of them up here, centered in Dubois. We went from 1 doctor per 1,200 residents to about 1 doctor per 2,400 residents. And the national average is one doctor per about 1,100 residents. We're definitely short on general practitioners in our county. We lost several entities or several procedures. Orthopedics are minimal. We lost ophthalmology. We had a phenomenal amount of eye surgeries occurring. We lost maternity. We lost ENT. We lost most of general surgery. We're now in a maternity desert the size of Connecticut. This area from Warren to Wellsboro, from the New York line to Du Bois is actually larger than the state of Connecticut without a maternity. We had several community meetings and we had some political pressure. Governor Shapiro's staff was actually very helpful. We set up a healthcare coalition with industrial leaders in the community. These leaders or these industries employ approximately 6,000 people that were supporting our initiative. Path forward, we approached the Elk County Commissioners about forming a healthcare authority last summer. We had a local attorney involved, pro bono. He hasn't charged us. And the PA Municipal Authorities Association is also very helpful. The Elk County Commissioners formed the Elk County Healthcare Authority, and our first meeting was in January of 25, January of this year. We formed a 501c3 corporation so we could receive charitable contributions. We received IRS approval in May of 25. The 501c3 is very important for tax deductibility. In theory, you can donate to the entity, but everybody wants a 25 number. And so it worked rather well. We're now getting some donations from the community and from our members, actually. With the consequence of maternity closure, it's been published about 3 babies born in ambulances. However, there have been actually more born in homes and stuff like that, where ambulances have delivered a baby in someone's house. It's really, I had a group of students at one of the local companies and talking to their HR director, and she said that, you know, it's hard to recruit to a rural area now, and it's even harder to recruit young people without a maternity leave. And so one of the consequences that just happened recently, Du Bois moved from a 2-star to a 1-star rated Medicare hospital. There are 229 of them in the US out of about 4,000 hospitals.
Excuse me, Gary, is that a step up or a step back?
That's a step down. That's the
Okay.
lowest level. That is the
Thank you.
lowest level available. I did go through a cursory overview of their data. They're not, I didn't see anything terrible. It's just on average. You know, they didn't perform on average very well in most functions. I actually talked to Trina about it. So progress to date, we've been holding a number of informational meetings to determine what it would take to return healthcare services to Elk County. One of the major issues that has come up is the medical malpractice insurance, the venue shopping that Pennsylvania Supreme Court allowed about 2 years ago. There have been some phenomenally high settlements with cases being moved to the Philadelphia area. You know, if you're charged with a crime, you're generally tried in Elk County, you know, in a jury of your peers. But if you're suing somebody and it's a big enough lawsuit, you go to any court in the state. And that didn't used to be. The Supreme Court changed that about 2 years ago. And there have been some settlements in the several $100 million range, which would bankrupt all but the largest health systems. Another thing that's hurting is OBGYN medical malpractice and premiums are 2 to 4 times what Ohio's are. I talked to an insurance broker, Cunningham Insurance. They gave me the rates for a rural versus that. Medical malpractice for an OBGYN can be $200,000 a year, just the insurance. So that causes some major issue, you have to do a lot of deliveries to pay for that.
So is the rate of the insurance controlled by whom? The industry, the state? I guess, why is Ohio more competitive in what they can provide?
They have pretty strict tort limitations on pain and suffering. Whereas you know, I sent a copy of their law actually to Chris Dush, to Skinny Armanini, to Marty Clauser, people that have been involved with us. And it's all of them say it's a very hard lift. Because the Trial Lawyers Association is very prominent in fighting something like that. But it is a detriment to bringing doctors into the state. And we've continued to meet with state and federal officials. We've applied for a $100,000 planning grant that we were turned down. But they gave some tips on how to tweak the application so we could try again.
So that's not uncommon,
Yeah,
as you're probably gonna learn.
yeah. What activities have we been involved in? We attended a joint Pennsylvania Senate and House of Representatives committee meeting on rural health. We met with the committee of the Federal Reserve Bank of Philadelphia on rural health and rural health financing. We attended the Pennsylvania Department of Health meeting on rural health at Juniata College, as well as the Pennsylvania Department of Health meeting on rural health at the University of Pittsburgh at Bradford. We attended the Pennsylvania County Commissioners meeting, and I was actually one of the chiefs in the discussion on rural health. We had informational meetings with virtually all of the major healthcare providers in central and western Pennsylvania in trying to bring what it would take to bring services to this area. And we've had Stackpole Hall involvement. They've come to a couple of our meetings, and they are setting up a working group with a couple members of our group on their group on basically looking at what Dr. Mark Richards was saying. He is head of the branch campus of Penn State Hershey Medical Center. But the branch campus is actually located at University Park. You know, you sort of think of Penn State as having branch campuses feeding University Park. Well, this is just the opposite. Hershey Medical Center has a branch there, and they're doing I'll probably misstate some of it, but they're doing a medical school that he's an ex-Navy carrier doctor. And so he says, we are teaching general practitioners to do everything from teeth to toes. He said he did fillings when he was on the carrier. He did surgeries. He delivered babies. He set bones. He did everything. And they're trying to get a rural GP program that can do virtually everything. He's a very impressive gentleman. If you ever have a chance to hear him talk, I've seen him a couple of times now. And he's a great person.
Gary, have you had any positive leads with any other healthcare entities?
We've had interest, but we don't, I was hoping we would have something to talk about here, but we've never, between the federal budget, between everything that's going on, we've had interest, but nothing concrete to bring.
But is that maybe interest still ongoing?
Oh, the interest is ongoing,
Okay.
absolutely, with a couple entities, actually.
Okay.
But they're not, you know, nobody, we're just holding, like, what I would call informational meetings, that's to say, what would it take to get you here? And so we're still meeting with a couple, I've met with chief financial officers at several of the healthcare facilities in the state. And we've met with presidents at some of the large healthcare facilities in the state, or vice presidents of strategic planning. I mean, we've met with Steve Fontaine. You know, we've gone through a lot, but we have a great demographic group here. We are in the entire Penn Highlands region, we're the second highest average household income. We have great insurance levels. We have fairly high fairly low uninsured population. I think our uninsured population is under 3%. So, you know, we have a great story to tell. We're just not big enough to really get people to want to commit to a massive program. But it is we have a great story to tell. The industry in this area and the insurance coverage and everything else like that's phenomenal. Like, you remember when we were on city council, Greg, and we lost the Giant Eagle. We talked to all the grocery stores and Wegmans came in and they looked at it and said, you have the demographics we want, except we need 100,000 people within 30 minutes. Otherwise, we'd have a Wegmans here. So, next, if I can do the next slide. Insurance activities. I don't know that you're aware of this, but UPMC has dropped the Medicare Advantage plans for Elk County residents. They kept Cameron County because they look at those tied to Potter with UPMC Cole. They kept McKean County with UPMC Kane. They kept Warren County because UPMC Chautauqua has some branches down in Warren County. But they dropped most of the counties where they do not have facilities. And then on the other hand, we've been hearing some noise from some of the people we've been talking to about a new payment system that Highmark's implementing, where they're getting much more aggressive on what they will pay for in terms of a duration of stay. They're trying to sort of follow the Medicare rules with private insurance or forcing shorter durations. Some specialists as a result are not accepting Highmark now. So, insurance is getting tougher and tougher, and hospital procedure payment terms are definitely changing. I mean, it's a rough situation out there. We have, we spend an enormous amount of money on healthcare compared to any other developed country, but we don't seem to get the bang for that dollar. I mean, we don't have the life expectancy of other developed countries and things like that. And that's countrywide. That isn't just here. So I believe that's it then. Any other questions?
So I have a couple of questions. First of all, we're thrilled to have you attend CCAP from Elk County. I couldn't be there, but I heard a lot of good feedback about your participation. So that's definitely a feather in your cap. I appreciate you sending your meeting minutes. When you send them, I always review them. And I see that there is typically a representative citizen rep from Penn Highlands. I don't know what you want to call her, but how has the relationship been with Penn Highlands? Any thawing?
Well, the relationships, we've had discussions with Steve Fontaine. I would say, the relationship, I haven't published any op-eds,
Okay, good, that's great. That's a good sign.
We had a couple of those out last year, last year. But so we've been trying to work with everybody. We're not excluding anyone.
Is that downgrade from 2 stars to 1 star newsworthy?
Well, I think it is, because having quality health systems are important to our area, as well as having health systems in general. So that's my opinion on it. I mean, actually, when you look at Penn Highlands, if they had just stayed with Clearfield, DuBois, Brookville, and St. Mary's, they'd be okay. It's the Mon Valley, the Connellsville, the State College, the $80 million they put in State College, it's doubling their debt to finance these acquisitions and that. I mean, they would have had a nice system without all those acquisitions, in my mind.
So Gary, when you say that they're down, the Medicare downgraded them, are you talking about, is that like the quality of care, or is that more processing of Medicare payments and services?
They have a tremendous amount of attributes they look at. It's everything from a hospital stay for a procedure. It's anything from infection rates. It's basically, how they're performing compared to their peers.
Okay,
So it's, and like I said, I went through Penn Highlands data. I didn't see any massive problems. I didn't see, massive infections or anything like that. I didn't see, but I saw a lot of things within one standard deviation of average, but on the lower end of that standard deviation. So it's tough. I had a good discussion at one of the, I think it was at Juniata College, with one of the presenters from North Carolina on some research he had done on hospital financial strength versus outcomes. And he hadn't completed the research, but what his hypothesis was that if you're a strong hospital financially, you're going to be a strong hospital in service. And his hypothesis was if you're a weak hospital financially, you're going to have trouble with your service. And I have to give him a call and see how he's making that out, because he was looking at, all 4,000 hospitals in the country and taking their Medicare rating against their bond ratings and stuff like that, and trying to draw correlations on, which is a bit of a statistical undertaking. But we had a nice discussion about it. And I, intuitively coming from industry, if a company is strong, usually they're strong because they like and everything else. And so it seems logical, but you can't say that without the data. You have to have the data to say that. And, he was at UNC Charlotte, I think, doing that research. I'll have to get back in touch with him.
well, all 9 of you on the authority are surely committed to what you guys are doing.
Absolutely.
Keep and maintain healthcare within El County.
Yes,
I think it's an outstanding thing, that time and effort that you guys are dedicating to it.
we have to, the industry end of it, we need, so we can recruit people to run it. We have to have these services here. I mean, it's essential.
Just to be clear, because obviously there's going to be folks that are very committed to the health system through Penn Highlands, and that's fine. There's a lot of good people there. So the intent for the healthcare authority was never to compete directly. It was to complement or fill gaps or do something. So I just want to be clear that
Absolutely. Fill gaps is the right definition. Where we have a gap and we need a service. And that is one of the things that Mark Richards talked about specifically. And he had set up a clinic in Huntington, PA, where they didn't have a dermatologist. So he set up a dermatologist clinic down there, and he said they see 30 patients every other week or something like that with dermatology.
and I'm sorry to interrupt. I should say too, that Penn Highlands President Peer is at those meetings. So I know there's every effort to try to have a good relationship with the healthcare system. So they're at the table with these meetings with Dr. Richards, Dr. Stevens, I think. But
Yeah, he's in an interesting situation because they have a federally qualified health system. So they don't have the medical malpractice issues that another entity has. He has an FERQC or whatever that's called, as well as the supply of student doctors.
Mhm.
So it's an interesting program they're at. And actually IUP is doing something very similar with their DO program. And they've mainly partnered with the hospitals across the southern tier. They've partnered in Cambria County and some of those counties for their residents and that. And they've somewhat excluded large hospitals because they want their students to have experience where they don't have the latest CAT scan, where they have to, know whether this person should be here or should be. So I think both of those programs are fantastic. the IUP one as well as the Penn State.
Great. Anything else, commissioners? Again, we appreciate your diligence. You guys have accomplished a lot in this last year, so.
It doesn't move as fast as industry, I'll say that.
A little frustrating, but thank you for that. Let us know, keep us updated, let us know anytime if we can help. Thank you. Okay, next presentation, it is the 50th anniversary of the Elk County Farm Bureau. We have Ernie Matus, Ray McMinn, and the Hallmaws here, so, good morning. Congratulations, have you been around for all 50 years, Ernie?
Not quite,
Oh, baloney.
probably, pretty close to it.
You've been farming for 50 plus years, right?
Yes.
I know. Well, great. So that's a milestone. You guys are very active here in the county, which is a great thing. I know our farms and our farmers are growing less and less every year, so we're glad you're here. We have great representation from Elk County on the state level as well, right?
Yep.
Yeah,
I do sit on the state board currently. Ernie did for 8 years ahead of me, so.
so we're great. So, the floor is yours if anybody would like to say anything. Otherwise, we have a citation here to present.
I appreciate the support the commissioners give. We like to, farming is, everybody wants to eat, right? So we would like to see a little bit more come back in Elk County, and we are trying to work to see that happen. It's all about getting people involved and getting the public to understand where it all comes from and how it works.
It isn't just food, right? I know the thing that caught my attention was no farms, no beer.
That'll work too. Well, you know, Chicken Hill loves us, loves farmers, right? You know, now we're allowed to do the microbreweries and the, you know, and the moonshine type thing and, Elk County's a little bit more active, I think, than most people realize, what actually gets produced here in the county.
Ernie, what's the next 50 years look like for the Farm Bureau?
It's gonna be very active. As far as advocating for legislation and that's an ongoing thing. We talked about healthcare. Farm Bureau is working on that on our end. We're trying as much as possible, talking with various legislators.
We're seeing advances in technology everywhere. I'm sure AI is probably going to creep into the ag industry as well.
Brandy and Chucky and I just spent 3 days in Hershey at our annual meeting, and there was a ton of discussion on AI and data centers. Not a whole lot positive, just to put that out there. And I think that, there's a whole lot going on with data centers and AI that's probably not something that's gonna be a happy topic, we'll say.
We're also working very hard to try to get grants for young farmers starting out in that. Staying on the farm. I'm here aware of it. Elk County right now only has one dairy farm in the entire county. In the 70s, there was over 100 of them. So that's a big issue that we're working on too, is try to get more young people involved in agriculture. And in fact, this week, Pennsylvania Farm Bureau Mobile Ag Lab is at the Ridgeway Elementary School. Right up there tomorrow morning. Look, so that's helping.
We will have representation there tomorrow morning. Commissioner Quisenberry's out for the day, but Commissioner Bauer and I are gonna split up. He's going to the ag lab and I'm coming here to a presentation. So.
We know Helene has done a lot of great work with the schools. The schools finally started with FFA and stuff. So, I mean, we hope that'll.
Yeah, the first year with their ag program, they already had close to 100 students. I think the last count was 97. So, I mean, for a first year, that's pretty impressive. And they were all St. Mary's Area School District students. The only, student outside of St. Mary's is Mary's grandson.
Sitting in the hallway.
It's the rich way.
He's welcome to come in.
You don't want him in here. Bigger than all the.
Yeah, but Helena now is a member of Farm Bureau since she turned 18, and she is the Elk County representative for GAP, the Young Ag Professionals. And so we're, you know, her involvement and enthusiasm, we're hoping that really represents the county on the state level.
She's a great ambassador for us, for this area, for sure.
And I think the FFA thing is very good. Farm Bureau is a very big supporter of 4-H and FFA. We always have the state councils both down at our annual meeting. They represent both programs extremely well. They're very good kids, and they're very passionate oriented on what in ag. And unfortunately, Elk County is a small county, and we need to work to bring some of that here. And I think yes, Helena is very enthusiastic. She's already told herself that she's going to take his job as president of farm. So she's got the drive. We need more of that.
That's great. Well, keep up the good work. We do have a citation here, and I will read part of it. And then I assume you would like a photo.
I was ordered to make sure we got one.
Great. Well, I love photos.
You all know my way, right?
Yes, yes. So
Don't leave here without pictures.
are you planning on staying for the rest of the meeting? Can we do the photo at the end, or do you need to leave? We can
I
do the
would-
photo now.
I kind of have to step out because Garrett does have to at the school by 11:30, so.
Perfect. So I'll read this, we'll present it in photo, and then you're welcome to stay or leave. So this is citation from the County of Elk Board of Commissioners. Whereas the County of Elk is always pleased to honor those organizations whose actions contribute to the betterment of the county and its citizens. And the Elk County Farm Bureau was created to be a voice for our local farmers and ranchers, to educate and promote ag practices and safety, and to provide the community with accurate information regarding food production and safety. Whereas in 1975, farmers got together and created the Elk County Farmers Association and worked hard to get their voices heard with our local politicians. That small group eventually combined with the Pennsylvania Farm Bureau, bringing even more voices together. Whereas dedicated volunteers work toward passing legislation to benefit Elk County farmers that might affect food, hunting, fishing, farmland, and more. The Elk County Farm Bureau members work together to make real change to advance agriculture. Now therefore, the County of Elk does hereby pay tribute to and congratulate the Elk County Farm Bureau for 50 years of service and dedication to the Elk County residents, and directs that a copy of this citation be presented to the Elk County Farm Bureau. Hereunto set our hands this 20th day of November 2025. So congratulations, keep it up. The photo quick.
Won't be long, we'll be doing the 50th anniversary meeting.
I know, probably I won't be here for the. Anybody else? Let me stand by you, Arnie.
Okay.
Okay.
Short people usually get front.
Stand in front of them. We should put you in the front, you're short.
Yes, ma'am.
Who's taking the picture? I'll never look. Evelyn. Missed you. 1, 2, 3. 1, 2, 3.
Okay, quick over here. Got it. Thank you.
Thank you. So congratulations.
Thank you.
More.
Probably won't be, I don't know, I'm getting old.
Thanks, sir. Good to see you.
Yep.
Thank
I
you.
make, I make 130 years old.
Let her know.
Well, they like it out there, but
I don't see very much. You're welcome.
you.
Recently happened.
We're gonna move on to new business now. Thank you, family. So make a motion that we approve the citation. Make a motion.
Second?
All those in favor signify by saying aye.
Aye.
Aye. Thank you, thank
Yeah,
you.
I know, okay, I got that.
Okay, no resolutions, old business. New business number one, we have before us a contract between the County of Elk and an individual for administrative services in the coroner's office from January 1, 26 through December 31, 26 at an annual rate of $6,000. So as previous, it's been policy of the county to pay a stipend to the coroner's, the sitting coroner for administrative support for their office. This has always been a casual, informal arrangement, but under advice from our solicitor and our chief clerk, we feel we need to make this a formal agreement. So right now we have the contract. The individual that's been working for our coroner, her name is Amy Fetus. That's why she's named in this, but this will just be a standard contract going forward for the admin support in the coroner's office. The rate is $6,000 per year. Questions, comments?
Well, I guess it came from the coroner. This request was something that we haven't adjusted this wage for some time, so she had come to us with supporting the idea that there's been a lot more to do with the administrative work under the coroner.
Brandy's the chairman of the Women's Leadership.
So we recognize that and agreed that a change was in order.
Formalize the process. Look for a motion.
I would make that motion, Commissioner.
Second.
A motion and a second. All those in favor signify by saying aye. Aye. Motion carries. Thank you. New business number two. Request from the prison for a renewal contract between the County of Elk and Center County for inmate housing for the next calendar year at a rate of $70 per day per inmate. So we have our Warden Atwell here this morning. Is that an increase or is that standard?
It's standard,
That's
it's the
right.
same, it's just a renewal contract, there's no change in terms. Center County traditionally likes, to renew this every year rather than extending it out 3 years or 5 years. So it's nice to have that availability.
So for general public information, we keep contracts with several surrounding prisons
Correct.
in case we need to house an inmate there or not. We may or may not use this, doesn't, but we always like to have them in place.
Absolutely,
And there's reciprocal agreements from other counties to use elk, so
yes,
it's not uncommon.
very cool.
Thank you. Look for a motion to approve that renewal contract.
So moved.
Second
A
that.
motion and a second. All those in favor signify by saying aye.
Aye.
Motion carries. Thank you. New business number three, we have a request from Veterans Affairs for approval. Thank you, Mr. Warden. For approval of benefits for 5 veteran burials, 1 spouse burial, and 4 veteran headstones. As we all know, our Veterans Affairs Office is quite diligent in keeping up to date with these veterans benefits. So I would look for a motion to approve this request.
So moved.
Second.
Motion second. All those in favor signify by saying aye.
Aye.
Aye, motion carries. Thank you. New business number 4, we have a request from the Elk County Housing Authority for, this is actually a reappointment of Joseph Dagger to the Board of Housing Authority Board of Commissioners from January 1 through December 31, 2030. It's a 5-year term, so it's a reappointment. Dagger's been on there for the last couple of years. So I'd look for a motion to approve this request for a reappointment.
Make that motion.
Motion and second, all those in favor signify by saying aye. Motion carries. Thank you. Next, new business number 5, we have a request from the Elk County Healthcare Authority for a reappointment for a term of 5 years on the Board of Governors to expire December 31, 2030. For Dr. David Joey and Crystal Ginther. So this is a recommendation from the Healthcare Authority. These folks have served since the inception of the board, and you're asking for them to remain on the board. The promotion?
I'll make that motion.
Second.
In a second, all those in favor signify by saying aye.
Aye.
Aye, motion carried. New business number 6. We have a request from the Area Transportation Authority. This is just an appointment, not a reappointment. For Joseph Dagger to serve on the Board of Directors, beginning January 1. January 1 or immediately. Joseph Dagger to serve, he's replacing Harry Whiteman, who just retired from the board. So we have a recommendation, a letter of request from ATA requesting that appointment. Look for a motion to approve that appointment.
So moved.
Second.
Motion and second, all those in favor signify by saying aye.
Aye.
Joe just wants to go on the board, but
Joe's, yeah, he's busy.
Monopoly guy.
He's busy.
He'll go on the board.
Yeah, he likes to know what's going on with that guy. New business number 7, a request from the Elk County Conservation District for reappointments to the Board of Directors for Mike Hovatter as a public director for a term to expire December 31, 2029, and Commissioner Greg Bauer to serve as Commissioner Director for a term to expire December 31, 2026. You good with that, Commissioner?
I'm good with that.
Okay.
I'll make that motion.
I will second that motion. All those in favor signify by saying aye.
Aye.
Motion carries. Thank you. We have new business number 8. It's a request from our Elk County Planning Commission for reappointment for 3 members for a term of 4 years each to expire December 31, 2029. Attorney Becky Craig will represent Ridgeway, Dale Anderson will represent Ridgeway, and Brandy Haynes will represent Benezet Township. These members have been serving on the Planning Department, Planning Commission, and we have a request from that department to reappoint those. Look for motion to do that.
Motion to approve.
Second.
Thank you. We have a motion and a second. All those in favor signify by saying aye.
Aye.
Aye, motion carries. New business number 9, request from the Elk County Redevelopment Authority for reappointment of Joseph Haynes to a term of 5 years, expiring December 31, 2030.
Joe Dagger.
Joe Haynes. Joe Haynes, yes. Says Mr. Haynes has graciously agreed to continue his service, etc. So you make that motion?
Second.
The motion is second. All those in favor signify by saying aye.
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 Aye, motion carries. The business number 10, we have a request from the Ridgeway Elk County Chamber of Commerce for courthouse lawn use on November 28th, 2025 for light up night. The chamber has been using the courthouse lawn for this event for many years. We have a good relationship with the chamber. They work well with our maintenance department, clean up any garbage or anything. So I would look for a motion to approve this.
So moved.
The motion, I will second that. All those in favor signify by saying aye.
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 Aye. Motion carries. Thank you. Completes our new business. We do have some correspondence. Pardon me, it's available in the Commissioner's office for further review if anybody would like to check that out. Under good of the county, we welcome and encourage the public to attend our meetings. Good of the county number 2, Patrick Straub, our chief clerk, was reappointed to the CCAP Health Alliance Board of Directors as the 6th class county representative for a term to expire December 31, 2027. So Pat has been serving on this board, and he was reappointed or elected by acclamation. Sounds pretty exciting. Bless you. Yeah, that's good. So, the managing director, Desiree, said Pat is a dedicated and active board member, and we're looking to have him on board.
What's so funny about that?
I'll see you in a couple of days.
So thank you, Pat, for serving on that. Okay,
Thanks for this.
you bet. Recognition of Harry Whiteman for his service on the ATA Board of Directors. So we commissioners attended the ATA quarterly meeting yesterday at the ATA headquarters in Johnsburg. And we presented Mr. Whiteman a citation for his years of service. He's been there a long time, not since its 50 years ago inception though. But he served on in many roles on that board, so we were pleased to recognize him. Next we have County Row Office Employee Appreciation Week. So Commissioner Gebauer, do you have anything to add to that for us, please?
Yeah, so, County Row Office Employee Appreciation Week is, designation for the week of November 16th to the 22nd, which is this week in Pennsylvania. This week is meant to recognize the contributions of county government employees that serve in the Pennsylvania Row. Again, it's just for Pennsylvania. So we would like to recognize all those employees that work in the under the row offices in Elk County. It's all about our government, and we would need those. We need those people. We appreciate those people for the services that they provide to the other row offices.
So we do have one elected, our treasurer, Matt Fry, so would you please extend our appreciation to your employees? And our other row offices are register, recorder, clerk of the Orphans Court, prothonotary, sheriff, treasurer, and
Judge, judicial coroner.
coroner, and commissioner, and he's not elected. He's not. Okay, yes, he is. Yes, he is. Okay. Great. So anyway, we're pleased to acknowledge them.
And I believe the court system too, the judge.
Great, thank you.
Just a couple of items, if we could quickly.
Certainly.
We were able to attend a site visit last Friday up at talk about the county's new communication tower.
Great.
Yeah, so I think it was in the paper here this past week, but we did finally complete the communications tower up in North Jones Township, northern Elk County. That is going to drastically improve communications for all of our emergency responders, police, fire, EMS, Elkland Search and Rescue. It's a 180-foot tower that was placed upon some land that we had purchased. It wasn't just any land. We had an individual working with us. Probably maybe his title would be like a land acquisitioner for other businesses, and he was able to locate the proper land with the proper height for us to put this tower up. So if anybody's cruising out on Rascillas Road, if you pass where the old church was, where the church on the right, cemetery's on the left, look to your immediate right, and you'll see our new communications tower standing up above the trees there. It's going to be, again, a great service. It's going to help communications in parts of Highland Township, northern Jones Township, even some agencies up in McKean County, Kane, Mount Jewett area, and even some responders from Cameron County, if they get anything on the backside of what we call East Branch Dam up in the Stray Creek area, that tower will help them out also. And it was paid for through the American Rescue Plan money, and I think the project got started before I became commissioner.
It was a very, very lengthy, involved, huge project. So we are thrilled, Rick Brown, our solicitor, was
He helped us
Helped
a great deal.
immensely
Instrumental.
instrumental.
Yeah, there was a lot of legal stuff, a lot of paperwork with acquiring the land and getting right of ways and whatnot, so
Huge project,
thank
we're
Mr. Brown.
thrilled it's done, right?
Yes,
It's a
absolutely.
grand direction.
And Jones Township, some of the Jones Township Fire Department members already spoke to me being a fireman myself. Said they've been trying to tower out in different locations and they said it is a huge improvement in their radio communications. And
So-
thanks Marilyn for your covering it.
Yeah.
For the information.
In terms of cost, by finding that perfect parcel of land, which is about 100 feet higher than what we were located on, we actually were able to purchase a shorter tower. Instead of having, it probably saved the county $200,000 by not having to get that extra distance to get the line of sight to where it really needed to be, so.
It's one of the highest elevations in
Well,
Johnstown.
Yeah, if you get above 200 feet on a tower, then you gotta put the lighting on it so planes can see it and whatnot, so, yeah, which took it to a whole nother level. So, because we were able to acquire that high point in Jones Township, we were able to keep the tower to the 180 foot.
So we are thrilled that we got that project put to bed. That was a big, big deal for a long, long time. And we had invited Marilyn to go with us last week, but she was unable, so, but thanks, you did a great job covering
Thank
it.
you for giving me the information to work with.
We took a bunch of photos, Marilyn, we figured you could just pick which ones you wanted to use.
I just, yes, tried to do the best I could. I sent two in. I always figure the paper knows better than I what's going to copy best,
Yeah.
so they picked the best one.
So thanks again.
Sure.
Thanks, Rick. Okay, questions from the press? Wait, one more thing. I'm sorry. Pardon me, pardon me.
Thanksgiving.
Happy Thanksgiving.
Thanksgiving,
Happy Thanksgiving. Yes,
CCAP stands for,
County Commissioners Association of Pennsylvania.
So it's a membership group for all of the Pennsylvania counties. So when Gary was kind enough to represent us, we're bringing in, counties across the Commonwealth from all different sizes and areas. So it's a big deal. So
thank you, that's all.
Very reputable organization. Okay, comments from taxpayers? Hearing none, look for a motion to adjourn.
So moved.
Meeting adjourned. Our next meeting is at 10 a.m. Thursday, December 4th, right here in this room. Thanks, everybody.